Knock, knock.
Come in.
Hi, my name is Jessica. I'm going to be your nurse today. I'm just going to close the curtain for your privacy while I wash my hands for your safety. Okay, I'm back. What's your name?
Tyler.
And what's your date of birth?
October 13th, 1988.
And do you know where you are right now?
I'm at the hospital.
Okay, so patient is alert and oriented, general demeanor, and everything seems content. I'm going to be doing a head-to-toe assessment on you today, so I'm going to begin with your head. Alright, so in looking at, I don't see any obvious, any signs of trauma, no deformities, contusions, abrasions, no bruising, nothing out of the ordinary just on first sight. I'm going to look into your ears. I see no discharge, no signs of inflammation. Okay, and that's true bilaterally. I'm going to whisper something in your ear and I'm going to ask that you say it again out loud.
Dog.
Okay?
Cat.
Okay, great job. Now, if you wouldn't mind, would you please remove your glasses? Okay, great. And I'd like to ask you to look at a spot behind me on the wall and focus on that. Okay, great. And now look at my finger. Good. And now follow my finger. Okay, great job. Now, I'm going to shine a light in your eye briefly. Just continue to look at the spot behind you on the wall, okay? Okay, good. Pupils are equal, round, and reactive to light and accommodate. And looking at her face, she's symmetric. Her nose is midline, septum is midline. I don't see any discharge from her eyes or her nose. I see no signs of inflammation. Would you please plug one of your nostrils and breathe in and out? Okay, and doing the same on the other side. Okay, nasal passages appear to be patent and clear. I'm going to look inside your mouth. Would you please open it? Great. Okay, oral hygiene is good. Oral mucosa is moist and pink as expected. I'm going to now ask, yes, you can put on your glasses. Okay, so if you wouldn't mind, go ahead and touch your right ear to your shoulder, if you can. Okay, great. And now your left. And would you look up, please? And look down. Okay, so good range of motion of the head and neck. I'm looking at the neck. I see no tracheal deviation, no JVD, nothing like that. I'm going to palpate her carotid artery on the left side. Okay, that's good. On the right side is good. Looks groovy. So now I'm going to listen to your lungs. So every time I touch my stethoscope to you, I'm going to ask that you take a deep breath in and out. Just give me a moment to put these on. Okay. Okay, and I'm going to ask that I can come under this side. Okay, and the same on the other side. Okay, great job, and there you go. Well, thank you. All right, now I'm going to, there you go, take a deep breath, great job. And okay, lungs are clear and equal bilaterally with good chest rise and fall. I'm going to stand behind her for a minute just to assess her spine and her posture. Her spine is midline. I don't see any abnormal curvature or anything like that. Her posture is good. Again, no signs of any kind of trauma or bruising or swelling to her back. Okay, so next I'm going to move on with the pulses. I'm going to check your brachial pulses. Good. And your radial pulses. Okay. And your posterior tibial pulses. Excellent. And I'm going to check your pedal pulses. Okay, all pulses are equal and within normal limits. while I'm down here, I'm going to check cap refill on her toes there. Okay, cap refill is good. Alright, and I'm going to check the cap refill on your fingers. Okay, great job. Now I'm going to go ahead and listen to your heart. Okay, so I am starting off on the right side of the sternal border, second intercostal space down, and I'm listening to the aortic valve. I'm going to move to the left side, second intercostal space down to the right side, and I'm listening to the pulmonic valve. Now in the third intercostal space to the left of the sternal border, I'm listening to Erb's point. The fourth intercostal space to the left of the sternal border, I'm listening to the tricuspid valve. And the fifth intercostal space, midclavicular, is the mitral valve, and I'm evaluating that. Okay, cardiac function is within normal limits. I don't hear any murmurs or palpitations or anything like that. Rate appears to be regular and strong. So the next thing I'm going to ask you to do is put your arms out like this. Okay, could you push up for me? Great job. And push down. Good job. You're strong. Can you go up forward like this? Now push towards me. All right, now give me some resistance. Excellent job. Okay, so I'm going to go either side of your thighs, and if you could just try to spread your thighs for me. Good job. And now push in. Excellent. Now push out towards me. Good. And pull back. And now if you could lift your feet up, and now push down like gas pedal. Good job. Okay, so I'm going to ask you to go ahead and lay on your back. Now, when was your last bowel movement?
This morning.
Okay, and was it painful? Was it normal?
Normal.
Okay, so no complaints. Okay, great. And what about urination? When was the last time you urinated?
About an hour ago.
Okay, and was there any burning or discomfort with that?
No.
Any discolorations or any complaints in that department?
No.
Okay, great. So I'm just going to observe your abdomen. The abdomen is flat. I see no signs of trauma, no bruising, no swelling of any kind. So I'm going to go ahead and just proceed and listen. I'm going to listen to all four quadrants. Okay, patient's bowel signs are normal, active. Now I'm going to be pressing on your belly, and I want you to tell me if you have any kinds of discomfort with that. I want to know if it hurts when I push down, but also when I release. Okay, and I'm also, during this time, I'm feeling for any kind of a swelling or hardnesses or any abnormalities. Okay. Any pain with that?
No.
Okay, great job.
3.
Okay, now I'm just going to assess your muscle tone. Okay, you appear to be well nourished. Muscle tone is good. Let's see any abnormalities. Okay, all right, great. And while I'm down here, I'm going to check for any kind of edema. I also didn't notice any abdominal ascites or edema. I see no edema on her lower extremities as well. She appears to have good range of motion in all extremities with no edema. If you could please spin and sit and face me. Okay, great job. And would you please stand up and close your eyes and face me? Okay, now I'm just checking for balance. Okay, good. You can open your eyes. Now, if you wouldn't mind, please just walk a few steps that way and walk a few steps back. Great job, and have a seat. Okay, her skin is within normal limits. There's no diaphoresis. It appears to be well hydrated and well nourished. The temperature and assessing is good. I'm going to go ahead and wash my hands and I'm going to give you your call light. Are you comfortable?
Yes.
Okay, then I'm going to wash my hands and I'm going to chart any findings I have. Do you have any questions?
No.
Okay, great. Well, then I will be back to you as soon as I have more information, or as soon as you ring that call bell, I'll be right to you.